this is about prognostication. So every conversation ultimately leads to, hey doc, how much time do I have? And oftentimes they've heard like a variety of prognosis. Hey, you've got 2 weeks. Hey, you've got 6 months. Hey, I don't know. It's like everyone's got a different approach to it. So in end-of-life care and hospice care, we talk about prognosis in this way: hours to days, days to weeks, weeks to months, months to years. And I always tell families, if a doctor says something more specific than that, they've never really done hospice or end-of-life care, because none of us are God. No one is following some blueprint of a disease trajectory. Now, there's caveats, of course, like everything. A pancreatic cancer diagnosis is pretty terrible, and the prognosis is really bad. Weeks to months usually by the time we make a diagnosis. Then there's like other situations where you can say, looking at all the research for this diagnosis, let's say you have a dementia patient, an Alzheimer's disease patient that broke their hip. Well, we have a lot of research that suggests that once that hip fracture occurs, your prognosis is less than 6 months. And so that qualifies for hospice. So another point would be that hospice is where the doctor says that your prognosis, if the disease progresses as expected, is less than 6 months. If the disease progresses as expected, and that's the subtlety. So when you create rules, like Medicare creates rules or insurance company create rules, they have to create some kind of benchmark. But, I've had lots of patients that have dementia that break their hip and live longer than 6 months. Now, these aren't folks that live 10 years. A good hospice agency will keep you on as long as it needs to be, and it's really up to the doctor when that prognosis changes. So I had a patient who had mild dementia, broke his hip, and, is a really close family member, and I was like, this is a bad prognosis. We're going to put him on hospice. Once we initiated hospice, there was so much improvement in his overall home care, even though he couldn't get into a clinic, that his prognosis extended. Now, a year after I discharged him from hospice, he ended up declining. We readmitted him to hospice, but at that point, family was ready. Patient was ready. His dementia had progressed. We had advanced care planning discussions. We knew exactly what he would want when that happened. So we reinitiated hospice, and he transitioned with his whole family sitting at bedside in his room, surrounded by love and affection and things that are, make him feel good. And yes, even if you have dementia, being in your home makes a huge difference. And we know that from robust research. But that's how we do it. We admit people who we think have a 6-month prognosis or less. But when I tell families that, I always leave wiggle room. So I never say 6 months. I never say 2 weeks. We just don't know. I set up that expectation, and then I say, well, look, anything can happen and change this. So if right now it looks like it's a months to years prognosis, if we get another complication, that might change to days to weeks. It's hard to predict.